front of you a link to a Menti poll. Please go to menti.com using the code on the slide and tell us where you're joining from. Thanks. Thanks, Colleen, for sharing the link. It's much easier to click on it than to type it all in. Welcome, everyone. We'll begin shortly. We did just share a Menti poll via chat. Please tell us where you're calling in from. I'll just keep repeating myself for a few more minutes while people join the call. Welcome, everyone. We will begin shortly. While we're waiting for others to log in, please log into the Menti poll on the slide and let us know where you're joining from. We'll begin shortly. Thank you. We'll do just one more minute. So for those that just joined, welcome. We'll begin very shortly. And while we wait, please feel free to enter the Menti poll and tell us where you're calling in from. Since this is an all online session, we look forward to seeing the diversity of backgrounds and geographic experience on the call. Thanks. So I believe we have a quorum to get started. Yes, Elizabeth, we will send the Menti poll link in the chat. Welcome, everyone. Have a good morning, good afternoon, and good evening, wherever you are logging in from, to the session called Infectious Diseases on the Move. My name is Fernanda Zarmoglio, and I work with the U.S. Agency for International Development, and I'm delighted to co-host today's discussion. While we wish we could be there with those of you that are in Glasgow today, the session will be largely virtual. So I would encourage you to log in to the Google Meet link that is provided in every single slide, to ask questions in the chat, which my colleague and co-host Colin Quinn will be tracking throughout the presentations and discussions. We organized this session because health issues, particularly those related to widespread vector and waterborne diseases, but not limited to those, are really bringing the connection between weather and disease risk to the here and now. Indeed, many have called health the human face of climate change. And without paying attention to how, where, and when infectious disease risks are changing due to altered weather patterns, we risk really undoing decades of investments and progress and locking up substantial future investments into responding to outbreaks and potential pandemics instead of focusing on development. The health, climate, and development community have really been working together to understand how climate and weather data can be leveraged to inform the disease control programs. And this session and the expert panelists that we have here today will help us explore where we've been, where we are going in our efforts to integrate climate and weather information into early warning systems for infectious diseases, and support of human health. We know that this is but a fraction of the experience out there, so we really encourage you to join the discussion. So please log into the Google Meet link and add to the richness and of the comments and the discussion that will happen. I am delighted to introduce this panel to you, and I will just do them in the order that they're presenting. Our first panelist is Mr. Lungi Okoko. Lungi leads the data integration team for the US-funded President's Malaria Initiative, which works to eliminate malaria worldwide. Lungi and his team have been champions in integrating climate and weather data into decision-making in support of eliminating malaria, and will speak to you about an early warning, early detection system that his program is scaling across Africa. Just a quick reminder, please don't forget to use the Google Meet link to join the discussion and ask questions. And over to you, Lungi. Thank you very much.
Yes, thank you, Fernanda, and good morning, good afternoon, everyone. So it's my pleasure to join this panel on behalf of PMI, the President's Malaria Initiative. And PMI is the US government's flagship malaria control program, which provides more than $700 million a year in technical assistance and programmatic support to 27 countries in Africa and Asia. And USAID is the lead agency for PMI, and we work in close collaboration with the CDC and Ministries of Health and national malaria control programs in the 27 countries that we support. And so the team that I lead within PMI, the data integration team, has been working on for the past 2.5 years or so, the development of a data integration platform that we call MDive, for Malaria Data Integration and Visualization Platform, which combines previously siloed data sets from disease surveillance to supply chain to financial and climate data and geospatial data at a very granular level from the 27 countries that we support. And that's a major transformation within PMI, because historically, those data sets were sitting in siloed databases. And so it was very difficult to align the data and to harmonize it for analysis. And the data we were receiving was often very aggregated. So within MDive now we have the much needed granular data that's needed to perform the level of analyses that's needed to provide optimal support to the countries that we partner with. We've been conducting user research with government officials and public health managers from our 27 partner countries in Africa and in Asia to build out MDive over time and to add new data sets, establish new API connections, and develop new features and functionalities. And our overall goal for MDive, and you can switch to the next slide, please, which will provide the overview, high-level architecture of the platform. So overall goal for MDive is to turn the platform into a tool that can help better allocate resources and even predict potential disease outbreaks across as many countries as possible. So it's within the context of developing MDive that during a bilateral meeting in 2018 at the World Health Assembly, that the Ethiopian Minister of Health requested technical assistance from USAID and PMI to help the government with the integration of malaria and climate data for predictive purposes. So we work with the Ethiopian Ministry of Health and climate scientists colleagues within our USAID Africa Bureau, so Fernanda and Colin on this call, as well as Iwateka and PMI Ethiopia colleagues to design this climate data integration effort in response to the request from the health minister. And so my colleague Iwat will provide more details on the Ethiopia experience. But just from a global perspective within PMI, now we're working on scaling the use of this early warning system so that as many of the 27 partner countries have access to the predictions and the forecasts as possible. And that's harvesting the district level malaria surveillance data that we get from HMIS databases, from DHIS2 databases, as well as the climate data that we receive on a daily basis from the Google Earth engine, and which feed into this machine learning model, which provides then the forecasts. So in terms of lessons learned, there is now since there's a fairly large landscape of malaria-specific climate-based predictive models, we wanted to make sure that we don't recreate the wheel. And so we ended up working with our colleagues from the Africa Bureau and climate scientists and to select an existing model that had been already developed and implemented in Ethiopia for almost a 10-year period in Amhara region under an NIH-funded grant to the University of Oklahoma. So this is called the Epidemio Model. And given the success that the model had been able to achieve in Amhara region, we decided to then reuse this model, and especially since it was developed in open source language, to then scale it to as many countries as possible using the data that we have. So our number one lesson learned is to really try to understand the landscape and do landscape analysis of what already exists before starting to develop new tools, and then to reuse existing tools, especially if they're developed in open source, which makes it much easier for reuse. Then second, given the multi-sectoral nature of this work, so I sit within the malaria team, but we quickly realized that we needed a multidisciplinary team that included the climate expertise that's much needed, as well as the data science expertise that we also needed to bring into PMI. So we were lucky enough to have epidemiologists and entomologists already within the USAID and CDC team to advise on this work. And then we're fortunate to hire a brilliant engineer from NASA with experience in climate-based risk modeling for disease outbreak predictions. That's my colleague Regina, a senior data scientist, as well as another data scientist that had experience in integrating platforms with DHIS2 with the malaria surveillance databases that countries are using. So that's a lesson learned number two in terms of building a multidisciplinary team. Third, to turn the predictive analytics into a tool that's as useful as possible to the underground actors. We conducted some fairly extensive user research to understand their needs and how the outputs from the model would be used from a programmatic perspective. And quickly, this helped us understand that based on the fact that the forecasts were provided about 2 to 3 months in advance, the actions that could be taken at the country level were really in terms of enabling the government to move malaria commodities. So those are test kits, rapid diagnostic test kits, as well as antimalarial drugs from a central medical warehouse or a regional warehouse to the districts that are most likely to see increases in cases based on the forecasts, or even to target those districts that are expected to see an upsurge in cases, target those districts with the supportive supervision activities that that PMI funds in collaboration with the governments. And then lastly, we continue to learn this lesson, not just in this work, but in some of our other data integration work, just how challenging it is to establish data governance mechanisms in terms of data sharing agreements with countries and with ministries of health. We had some early discussions with the Federal Ministry of Health in Ethiopia, where we learned a lot from those negotiations, and then as it relates to the climate and malaria data integration work, there's also the added layer of data governance, also that includes the national meteorological agencies, which adds another level of complexity. So that's a lesson that we continue to learn in terms of how do we address the tension between privacy and security and country ownership with the greater public health needs in terms of treating data as a global public good and all of the benefits that come out of these types of forecasts. So with that, I'll turn it over to my colleague, Iwateka, to share more about the Ethiopia experience.
Thank you, Lungi. My name is Heatwave, and I've been working for the past 10 plus years for PMI on malaria, which is one of the climate-sensitive diseases. Today, as Lungi mentioned, I'll be sharing Ethiopia's experience on supporting the climate-based early warning system to forecast malaria. And as the next slide, please. As Ethiopia, as you know, one of the second most populous country in Africa with 1.1 million square kilometer landmass. It has a diverse topography, and that ranges from very mountainous areas with 4,500 meter above sea level to the lowest point in the world with 125 meter below sea level. So it's very diverse, and also this topography also affects the diverse climate conditions in the country. And these were important determinants for health in the country. Cognizant of this important variable, the Ministry of Ethiopia has been engaged in developing national framework, climate resilient health sector. And among the objectives in this framework, enhancing early warning and surveillance systems in the country is important. That helps in mitigating effects of climate variability and change on health. Over the past 10 years in our country, local universities in collaboration with other US-based or other European universities engaged in producing research evidences that informs forecasting tool development. Among these tools, Epidemio is the most advanced one with the capability of generating reports with maps that informs the local malaria prevention and control programs. As Lungi mentioned, it helps us to target commodity movements from one district to another, as well as providing supportive supervisions to epidemic-prone districts. So this tool is an open source software that reduces time-consuming processing through automation, and the reports includes, as you can see from the slides, it includes early warning signals along with malaria incidence maps and also climate anomalies. So this has been, as Lungi mentioned, over 10 years of work in Amhara region, and USAID came in and also supports the system to be validated in the one of the biggest region, Oromia, as well, on how this data could be integrated with climate and successfully adapted to the Oromia region as well. And also PMI supported the roadmap for national scale, which stipulates in that roadmap a success of implementing such systems relies on a continued collaboration between the experts, the climate and data scientists experts from the US and also in the field and also in country to create a pool of experts that would be working on the systems. Next slide, please. So this would help having those critical mass of data scientists and climate experts and also epidemiologists. This will be important in continuing to develop this system. As well as in the future adding more additional data such as entomological data set for vector-borne diseases, and also to extend this system to other climate sensitive diseases such as dengue and other arboviral diseases as well. So this system has been very important for Ethiopia's context, and it has also been informing the local district level managers to contain some uprise of malaria cases in some districts. And this has been very helpful in the Ethiopian context. Then I'll be forwarding to the next presenter. Thank you.
Excellent. Thanks so much, Lungi and Iwa, for a full journey across a research project that began 10 years ago to its application and use in other parts of Ethiopia, and further sort of how we leverage all of that wealth of information and experience to scale up the use of predictive modeling with incorporating climate information across an agency's portfolio focused on eliminating malaria. Just a very rich example of what can be done and the challenges, especially those lessons around co-creation and the multidisciplinary teams that really need to be brought to bear in order for this data to be leveraged effectively. I would really like to remind the people on the call that we are keen to hear of other examples throughout the presentation. So if you have thoughts or ideas or questions, please do put them on the chat. We will aim to answer them. Going from the work that we have done on malaria and climate, I'd like to shift the discussion a bit and introduce you to Dr. Lim Hapairai. Lim is an entomologist with the Pacific Island Health Officers Association. He is the principal investigator on a project called Diminishing Dengue in the Pacific Islands. And the project is looking to develop predictive models for dengue, among other things, incorporating climate information. And it is at a rather more nascent stage than the Ethiopian context, but I think that we can learn a lot from the design and thinking of this project and moving forward, moving the needle around the use of climate information in support of early warning and early detection. Over to you, Lim. Thank you.
Thank you, Fernanda. And I'm happy to present our work in our parts of the world. And I'm happy to present Paho and wanted to recognize the support that we've gotten from the Department of State and for their continued support. And particularly this afternoon is to talk about our project and what we're doing in terms of developing an early warning system against dengue, but also arboviruses generally, particularly in the Federated States of Micronesia and in the Republic of the Marshall Islands. So as many of you know, the Pacific region, we're especially vulnerable to these arboviruses, these outbreaks that are usually vectored by these Aedes mosquitoes. And the trend is not good. Since the 70s, these U.S. affiliated Pacific Islands, so we're looking at Guam, Marianas, and I mentioned American Samoa, but Micronesia, Marshall Islands, and Palau, we keep getting these outbreaks, and it just seems that it's getting stronger and it's lasting longer and longer. And for many climate experts, the Pacific Island countries and territories, including our U.S. APIs, have been considered like the canaries in the coal mine. I just want to point out, the example of Zika, that it was first isolated in Africa, then jumped in Yap in Micronesia in 2007, then circulated throughout the Pacific region before gaining this worldwide attention and spreading to the Americas. So in no sense, we are tiny, but we are those canaries, and there's a consensus that climate change, ironically for countries who contribute so little, are affected so much. And particularly in the dengue outbreak in 2019, is not an exception. It proved that we really needed to change our game plan. Simply reacting to an outbreak, that's what's done in the past, it was no longer acceptable. And in many islands, we're talking about remote, simply getting there is a challenge. Procurement of vector equipment is a real struggle. And for many island communities, vector control in terms of response to an outbreak is only allowed once the village leader gives permission. All of that adds time to formulating a response. So the solution, and we're grateful with the Department of State, our objective is to focus on scientific evidence while embracing our Pacific Island ways. And what we need is lead time. We need to prepare a public health response. Many islands are remote, as I mentioned, and lead time will allow us to train these staff, perform these outbreak-ready maintenance and procurement, and get those resources and reduce those mosquitoes before things happen. We're also working hand in hand with our stakeholders in the community for input towards implementation of these early warning systems. There's no use of creating a predictive model if no one's going to use them. And so while we're constructing these predictive models, we're planning to hold workshops, trainings, and also conducting stakeholders and community surveys, just probing in, listening to them. Another important thing to us is to build climate and health adaptation plans. Our project seeks to build resilience for Micronesia and for the Marshalls, but also to expand that to the other U.S. APIs, so U.S. Pacific Islands. And we're working with vector management, we're working with them in the protocols, and down the line, instituting policies. So just a few details about our project. We've covered a lot about, Okoko talked about early warning systems, so I'll skip all those details, but what I wanted to say is our project is building predictive models based off climate, humans, and mosquitoes. We're exploring things like migration, interaction with the mosquito vectors, and we're also exploring dengue transmission and their environment. We're going into hospital records, getting that data. We're going to surveillance data, getting that data, and coming out with our models. We have weeks and up to months lead time, so we're really excited to work with our stakeholders in the communities. We're new. Since our project kickoff last year, our team has learned and we're still learning many, many lessons. But the first lesson is you have to listen to your stakeholders in the community. As requested by our stakeholders, we're building these risk maps. So that's for YAC. They wanted to say, hey, what's going on in our village? So we've taken these different data, the climate, the temperature, taking the mosquitoes, and we're taking humans, and we're putting that and allowing them to see what's going on. So we want to empower them for data making. Ultimately, we're not the decision holders, they are. The second lesson is we need to increase capacity. Historically and currently, functional capacities often reach a tipping point, and I think one of my figures came off of the slide, but every time that reached the tipping point, it takes years, months for the whole health system to recover. So with the Ministry of Health, we're building these sets of outbreak readiness protocols. And as soon as travel resumes, we'll be there. We're going to train the vector management. We'll be with the staff. We'll teach them how to look at numbers. Spend time explaining to them and having a sense of they are ultimately those who will have to make that decision. And all of that, we strongly believe will increase their capacity. We will increase the capacity of the local health workforce, first, both in the Micronesia and the Marshalls, but then again, we'll develop these roadmaps, and then we're planning on rolling that out to the other U.S. affiliated Pacific Islands. So Guam, Marianas, American Samoa, and Palau will have access to those. And with that, I'll finish and say thanks to everyone.
Thanks so much, Lim, for that extremely interesting presentation and for highlighting the challenge and the absolute need to connect and empower those who need to make decisions and build their capacity in responding proactively to risks as opposed to reacting to just the changing nature of disease incidents. So I really take my hat off to you. It's some interesting, very interesting work that is being done there. And I'm keen to hear how it develops. I'm sure others are as well. Thanks so much. Next, I would like to maybe take a proverbial step back in this space and learn from Dr. Kirsten Johnson, who is the team leader for the Famine Early Warning Systems Network called FuseNet, which provides information, including climate information, but also market and food insecurity information and analysis in support of partners and development partners addressing food insecurity issues. So FuseNet has been operational since 1985 and offers some really important lessons from the food security sector that we can potentially use in the health sector as we build out new early warning and early detection systems. So over to you, Kirsten, and thanks so much for joining us.
Thank you so much. It's great to be here. The presentations so far have been just fantastic and inspirational. My name is Kirsten Johnson. I'm here today with my colleague Shana Craig. As Maria mentioned, we are from USA's management team for the Famine Early Warning Systems Network, or it's more often called FuseNet. Can we hop ahead to the next slide? Super, thank you. Oh, no, back one. There we go. Okay. And so just a quick summary, although Maria did a great job already, that FuseNet is the global gold standard for early warning of acute food insecurity. Its primary objective is to make sure that USAID has the food security and climate-related decision support that it needs to deliver timely humanitarian food assistance to the people who are in greatest need. Over its 35-year history, it's also become a global public good. So governments, organizations, researchers around the world rely on FuseNet to meet strategic information and decision support needs. Next slide, please. So FuseNet's global staff, and again, we are fully reliant on our locally hired staff, both in our local field offices, as well as our regional and national scientists, climate scientists. FuseNet staff gathers and integrates data on risk factors for acute food insecurity. They integrate these data on climatology, climate-related events like droughts, floods, and storms, land use, and specifically agricultural production, livelihoods and nutrition, markets, trade, and prices, conflict, infectious disease, both human and zoonotic. Well, I guess in these cases, they're all zoonotic, but human and livestock disease, let's say. So we integrate all these data. They're synthesized to produce forecasts up to 8 months in advance of populations in need of emergency food assistance. How many people are in need? Where are they located? How severe are their needs likely to be? So by having this evidence-based forecast information, the FuseNet team can support early decision making that gets out ahead of these developing crises. These early warnings allow for early action by humanitarian agencies, by USAID. And that early action then translates into saving lives and livelihoods. Next slide, please. Thanks. So FuseNet's work in Ethiopia really illustrates how early warning of drought and famine, followed very quickly by early action, can save lives. And I guess at this moment, it's appropriate to kind of take a moment to think about what's happening right now in Ethiopia. But thinking back to the 80s, between 1983 and 1985, the world witnessed an exceptional year-over-year drought in Ethiopia, which ultimately led to crop failure, livestock losses, and famine, in which hundreds of thousands of men, women, and children perished. There are those of you, like me, here who will remember those images, the global press coverage, the voices raised all over the world to bring attention to what was happening in Ethiopia. But by the time that most of us heard about it, it was too late for too many people. And all the world's attention couldn't bring back those whose lives had been lost. But what did come out of that tragic event was a motivation for USAID to create FuseNet. So that in 2014, 2015, and 2016, as Ethiopia was again experiencing another exceptional year-over-year drought, that again led to crop and livestock losses, water shortages. FuseNet's data-driven early warning allowed USAID, in cooperation with the government of Ethiopia, to take early and robust action. And in that instance, the emergency food insecurity and famine were prevented. So this is just one example of how early warning systems are demonstrably effective in helping to avert worst outcomes. And in FuseNet's case, we're talking about famine. Next slide, please. And so what's interesting is that, like risks for food insecurity, risks for many infectious diseases also vary as a function of climate and land use change. In fact, if we look at all of the different kinds of variables that are included in FuseNet analyses, we can see that many of these are also risk factors for exposure or vulnerability to infectious disease. Given that, as we've seen in recent IPCC reports, there's evidence that climate change is shifting the geographic range, the seasonality, and the intensity of the transmission of climate-sensitive infectious diseases. So given the relevance of FuseNet's data to understanding aspects of those shifts, we are very interested in exploring with colleagues on the call today, with NOAA, USGS, and colleagues elsewhere in USAID. How can FuseNet's local expertise, multi-sectoral data, our analytical capabilities, the kinds of systems that have been set up over the course of the past 35 years, the networks, how can those existing capabilities help to contribute to the effort to identify areas at high risk of infectious disease transmission or emergence, thereby allowing for early warnings so public health and health system actions can be taken, again, so lives can be saved. Over. Thanks.
Thanks so much, Kirsten, and for highlighting, I think, a very exciting opportunity to leverage that knowledge, that experience, those systems that have been in place in support of people. Health specifically, I think is a really fantastic idea that needs to be further explored. You also mentioned something that I thought was super helpful, and it reflects what Lim and others have said during this session, which is that the climate is one piece of an information universe that needs to be considered in support of the work that we do as development professionals. And bringing those puzzle pieces together will help us be more proactive in our in addressing the risks that we are seeing increasing over time. So thanks so much for that presentation, and we very much look forward to working with you again. Let us close the session presentations let me introduce to you Dr. Chris Ebi. Chris Ebi, is she on the call? She has been coming in and out, so I just want to make sure that she's here now.
Hi, Fernanda, I'm here, but I
Hey,
can't
Chris.
turn on my
Okay.
camera, unfortunately.
No worries. Let me introduce you then, just to make sure. Chris Ebi, for those who don't know her, is a rock star professor in the Center for Health and Health in the Global Environment at the University of Washington. She has been conducting research and practice on the health risks of climate variability and change for over 25 years and has really focused on understanding the sources of vulnerability and estimating both the future and current impacts on health risks, as well as supporting adaptation policy development, such as the HNAPs that Lim mentioned. So I'm going to hand it over to you, Chris. I'm really keen to hear your thoughts on where we've been and what you think we can learn from these experiences moving forward to address the crisis of our time. Thanks so much.
Well, thank you so much for the kind introduction, Fernanda, and thanks to you and Colin for just an outstanding series of presentations. As you mentioned, we are at a critical moment in time, and there's so much good that we can bring by pulling together the different fields that have been mentioned so far in the presentations. All of the health risks of a changing climate are current problems. As the climate continues to change, we're going to see those problems in new places, with longer seasons, with different intensities of transmission. The work that's gone into developing early warning systems is just the start. We have so many possibilities for bringing in environmental and also, importantly, as mentioned by several people, the socioeconomic information, working with the communities to ensure that we can develop early warning systems that have sufficient lead time. So there's plenty of time for the ministries and departments of health and for the communities on the ground to start cleaning up breeding sites, for example, of making sure that they are ready for when the conditions are right to have an outbreak of an infectious disease. The diseases that were discussed so far in this webinar have been causing suffering and death for millennia, without an understanding that we know a lot about how the environment creates conditions that are conducive for having an outbreak. And really coming together as diverse scientific disciplines in partnership with the people on the ground means that we can make a difference today, even as the climate continues to change and we continue to modify our early warning systems. And there's so much benefit that can be brought right now at this moment. So I'm really excited about the presentations, really appreciate the research that everybody's done, and really appreciate the opportunity to highlight that we can start learning from what's being done, not just within health, but within other sectors such as the FuseNet, and having much broader discussions so that we can learn those best practices, quickly scale them up, and start making the difference that we know is possible today. With that, I'm going to end here because I'm sure there's going to be questions, and I'd like to hear from the audience what kinds of questions they have. And apologies, I can't turn the camera on. I'm in the United States, but I don't have enough bandwidth to be able to turn on my camera. It's the reason why Congress just passed an infrastructure bill, so hopefully next time I can have the bandwidth to turn my camera on. Thank you, everybody.
Thanks so much, Chris. We appreciate the intervention on sort of the current state of affairs in the U.S. Thanks so much for that. And I think that your call to implement, scale, and build on that sort of critical evidence base that is rather significant today, but needs to be improved, or that call is well heard. And I hope that we are able to meet the moment. With that, I would like to just open up a new Menti poll. And while you take some time to answer it, Colin has added the link. Maybe Colin, you could start to field some questions that have come through the chat for the participants. Over to you.
Yeah, thanks so much, Fernanda, and thanks so much. We're not in person, so it's a little different, but a huge round of applause for all of our presenters and sharing this great information. I think this is a great community to have to further limit the risk of climate change on these infectious diseases. So thank you so much. I'm going to leave that Menti poll open for a few minutes or for a couple minutes. So please go to that menti.com and use that code, or go to the link I put in the chat, and we'll give folks a couple minutes to answer that while we answer some other questions. There were lots of good questions in the chat. Let me scroll back through. Nancy Diaz had a good question, I believe, for Hiwat and Lim. And are these early warning systems tracking drug resistance? Nancy, would you like to expand on that?
Thanks, Colin. I just recently attended an event last week at CSIS about AMR and its links to climate change and antimicrobial resistance. So I was just curious if this is something that any of these warning systems were considering, or if they might consider that, given how timely all of these urgent issues are. Thank you.
I can answer that. So for dengue, unfortunately, we don't use any antibiotics, but what we do use are chemicals. And part of our model looks at making sure that the chemicals that we're using are doing what they're supposed to. So we're definitely looking into insecticide resistance and plugging that in when those data will become available. Over.
Yeah, Hiwat, would you like to add anything to that?
For this specific tool, we used weekly malaria case data and integrated with climate variables. But we're also supporting monitoring of drug resistance. But this particular tool is used for early warning of case increment within the districts. Over.
Thank you, Hiwat. Thanks, Lim. And I'll work to get through several of the questions in the chat. But if people have questions they would like to put, just feel free to raise your hand, and I'll call on you too for the next 10 or 12 minutes. Wasila had several questions about how the model was set up for the Ethiopia example in particular. So Wasila, I'll hand it over to you to ask those questions instead of trying to rehash them from the chat.
Thank you for the opportunity, Colin. Yeah, I was just asking the question because I was really impressed by the presentation on Ethiopia, and I was just wondering what climate data they used to drive the malaria model, if they were predicting malaria incidence for a particular district and season. And if they do, have those forecasts been verified? Because that's a very useful information to advance early warning in malaria and for any actually climate-driven infectious disease.
Yeah, thanks, Wasila.
I tried to answer these questions over the chat. We're using weekly confirmed malaria case data integrated to rainfall. In some parts of the country, rainfall drives the transmission. In the other, for example, in the eastern part, in some of the western central part, temperature would be the driving
Okay.
Variable. So they have used generic algorithms to classify climate variables to very variable in our country. the other for malaria risk mapping, which is annually we use it to stratify and then decide which mix of interventions are important in which district. So we use incidence data modeling and forecasting using the weekly malaria forecasting data sets. As to there is also a model within the tool that has a validation and skill scores. Retrospectively, it can validate how the forecasting were accurate. So those are also built in within the current finalized tool of.
Thank you, Hiwa. And Wasila, some of the climate and weather data comes from Google Earth Engine, and it's essentially real-time
no,
data.
That's great. Thank you very much. I would love to follow up with Hiwa at some point in time. Thank you.
Great, thank you. I'm seeing if there's any other raised hands, or did I miss any of the questions in the chat? All right, so several people have responded to the Menti poll. It says, what do you see are the opportunities for using climate and early warning for health? And this is, I think, it's really great to have a broad perspective here so we can use this information moving forward. So tracking changes and keeping ahead of trends, that's something Lim talked quite a bit about, not just reacting to outbreaks. Bundling interventions with other sectors and not just health, using the One Health approach. Absolutely, and I would even expand on that. Learning from other sectors like the FuseNet food security. FuseNet focuses more on food security and learning from what they've learned in food security for early warning and how we can use that for health. Scaling what we know works. Yep, I think that explains itself. Most, if not all, of the global human, animal, and ecosystem health threats are exacerbated by climate change. Infectious diseases, AMR, pollution, land degradation, biodiversity loss. Yes, completely agree. Weather and climate models are now capable of predicting extreme climate events. These could be integrated with socio and economic data. Absolutely, and I think in Ethiopia, for example, looking at internal migration at the same time as we're looking at malaria risk is essential because as people move around, that changes the risk profile quite a bit. Heat health warnings. Yes, we did not touch much on heat today. There were a couple other events at the WHO Health Pavilion that focused on heat, but specifically heat and maternal and child health. Heat waves and heat is rightly so receiving more attention than it has in the past, and those early warning systems will be essential. Integrating climate into detection and surveillance data programs. Yeah, I think that's one of our biggest challenges, to be perfectly honest. I think climate and health communities don't always speak the same language, and integrating climate data may seem like an easy thing to do, but often it's harder when you get to the kind of the nuts and bolts. Tracking evolving vector ecosystems and reproduction, early warning for heat effects on health systems infrastructure, same as for other disaster events, absolutely. And I think this is a really good point that somebody added, is that the health sector's devastation by COVID-19 is a great indicator of what may be coming up next. I think COVID-19 is obviously devastating, but it's an opportunity for us to think about how our health systems can be more resilient, not only to outbreaks such as COVID, but other infectious diseases as well. It's a really good example there. Increasing the visibility, the threat of climate change and AMR and mobilized action. Yes, and I think that's part of what we're trying to do today. So it's so nice to have so many people on the line to participate in this. Using new technologies, identifying zones where climate change or forced migration. I think that's one of the emerging issues we're seeing, maybe particularly in Africa, and especially in internal migration. We're seeing more and more internal migration and climate-induced migration. So understanding how that impacts the spread of infectious diseases and how we can be prepared is essential. And then quite a bit about rainfall and not just looking at heat. Not just looking at temperature. Absolutely. So yeah, thank you so much for that input. And are there any other questions, or Fernanda, would you like to close us out?
Yeah, if there are no other questions, which we're happy to field, I wonder, Colin, if you could put up the map of where people are calling in from. I just want to begin by thanking everyone on the call for joining and encouraging us to keep the conversation going. I think this is a good group that has a cadre of practical as well as research experience that can really do make a positive change happen in the health space for people, based on the sort of the experience we have on board. So really want to thank you all for participating. Want to encourage you to keep the dialogue going, and have a great day if you are in Glasgow or wherever you have joined the call. So thanks so much for your time. Thank you to the presenters as well. It was magnificent.
response then in the chat if they can hear us.
Can you hear me now?
Yes. Hello? Hello? Do you hear us okay? We can't hear you. Could you please say yes in the chat if you can hear us? Okay, perfect. Great. Great. Awesome. Thank you so much. Thanks for joining a bit earlier.
Okay, everybody. You're set? Really wonderful to see you all here this evening. Jumping the gun. Take two. Take two. Do that again. Oh, I see.
You're 30 seconds early.
Yeah. Hello, good evening. Great. So, good evening from the Health Pavilion here in Glasgow. Particularly good day, good night, good afternoon, if anybody's having a sleepless. You need to have your headphones on. Oh, you need headphones, Liz. A sleepless night. Thank you for joining online. And my name is Madeleine Thompson. I'm the head of climate and health impacts at the UK's Wellcome Trust, which some of you may not be familiar with. So I'll just introduce it. It's one of the largest charitable foundations in the world. It supports health and medical research. And one of the reasons why I'm here moderating this session, and which I'm delighted to do, is because the Trust itself has just started a major new program on climate change and health. You will need some headphones, yeah? And also on a personal level, I have been engaged with colleagues here for many years in thinking out how can climate knowledge and climate information benefit the health community and improve health outcomes. And some of you will have been in for the previous session on early warning systems, which gave some of those examples. But key questions that they brought up were issues around data governance, which is a huge challenge in this area. They also brought up the benefits of working across sectors, which I thought was very relevant to our discussion today. So we've got a pretty packed agenda. We're starting with a panel here with my expert colleagues that I'll introduce in a moment. And then we will have online 3 case studies, one from the UK, one from Germany, and one from the Caribbean. And that will be followed by 2 colleagues, one from NOAA in the US and one from WMO, talking about the development of services that are going to enable us all to move forward much more productively, I hope, in the coming years. So I hope you stay for the whole session and enjoy it. And if we keep to our time, we'll have a little bit of space for questions at the end. So on my left, I'm going to sit down first and just say quickly, we have Ian Lisk from WMO, Diarmaid Campbell-Lendrum from WHO, and Judy Amumbo from the Science for Africa Foundation. And we're going to start with asking Ian, why climate services for health now? What makes it a topical issue?
Thanks very much, Madeleine. So just a little bit more about me and what I do. I'm WMO President of the Services Commission. The WMO completely restructured itself in the midst of COVID, I might add, which was a bit of a challenge. We now have 2 intergovernmental technical commissions. I'm the President of the Services one. My colleague Michel Jean is President of the Infrastructure Commission. That looks after all the data, you just mentioned data, the modelling and all the observations coordination. I'm and my various expert teams are responsible for applying that amazing information and the science brought forward by the research board within the WMO into applications and services for members and decision makers. So, why integrated health services now? Well, Madeleine, it would be very, very strange, quite frankly, if the WMO and the WHO weren't working closely together. They have been working closely together, quite informally, for the last decade or so. We've had a joint office with the WHO in Geneva, in the WMO building for a number of years, and Joy, who I believe will be speaking today, has been that project, has been that officer, as it were. There is clearly, with most aspects of health, either a causation fact caused by the weather and the climate, or indeed a compounding issue with the weather and climate. And if we think about COVID at the moment, whilst the direct relationship of COVID and what the weather's doing is probably rather indistinct, if one was absolutely honest. The research board within the WMO has had a task team looking at this with the WHO over the last 18 months. So the causation, what's the weather doing and what the COVID case is like, is by no means direct relationship. However, the behavioural aspects obviously play a significant part in that, and it's been the seasonality there for people's behaviours and what the weather does has been, if you like, a nice example of why we should be working cheek by jowl with our colleagues in the WHO. And that goes for a range of other health impacts, whether it's heat health, whether it's air quality, and we all know that the impacts of climate change, even with a 1.5 scenario, or probably more realistically 2 or a little bit more than that, are likely to exacerbate those those impacts in terms of more heat-related issues, more water stress-related issues, I'm afraid more air quality related issues, and of course urbanisation, bigger populations living in cities and what have you. We need to be working in partnership with the WHO to do that. And so I'm delighted that at the WMO Executive Council in June just gone this summer, the WMO Executive Council endorsed the formation of a joint study group between the WMO on the WHO on integrated health services, and this lovely gentleman to my left here is one of the co-chairs of that group moving forward, which again demonstrates the importance of those two UN agencies, a very large one in the WHO and a very small one, but important one in the WMO, in terms of joining forces to do this in a properly integrated way. Thanks, Madeleine.
Well, thank you very much. I think that really actually allows us to segue very nicely to Diarmaid, who leads the climate change program at WHO, and in particular this global governance interaction at the UN level. That's all very nice, but WHO has a responsibility of making sure that knowledge actually gets to the countries, and it's in the countries at the local level that adaptation really takes place. And clearly you need to know what you're going to adapt to. So for some areas they're going to have more heat. For other areas, it's going to be sea level rise. For other areas, it's going to be drought. So just how do you bring that knowledge and where's the opportunity, if you like, of climate and health now for WHO and taking that to the countries? Diarmaid.
Well, thanks very much, Madeleine, and thanks very much for the overly kind introduction, Ian. I think that the question you ask is a central one because, well, I would say as WHO, but much more as ministries of health and as the health community is tasked with protecting people from the impacts of climate change, from the health impacts of climate change. And it ends up tasked with picking up the pieces or trying to absorb the risk of bad decisions that are taken elsewhere, including in pumping a load of greenhouse gases into the atmosphere. And so the really important action is in that work of assessing what the risks are from climate change to health, and you've just described some of those very well, and then considering what are you going to do about it? How are you going to protect, once you've identified that climate change is going to raise sea levels, it's going to make it easier to transmit certain infectious diseases, and some things we're absolutely sure are going to happen or are already happening, such as increased heat waves or increased severity of heat waves. And in some cases, we're not talking about a small percentage increase. We're talking about multiples of increase. So, to concentrate for a second on that heat wave example, we have the effect of climate change on heat stress is to multiply what would be a 1 in 20 year event, not by 5% or 10%, but to make it, a 1 in 5 year event or a 1 in 4 year event. It's many times worse, and it compounds with other things. And so ministries of health and us as WHO trying to back them up need to consider, okay, what are you going to do about that? And the really important stuff is actually at the intervention level. It's in supporting ministries of health and other agencies to to assess those risks and to put into place actions that will protect populations. And I know you've asked the question, why now? In some senses, it's not just now. In fact, WHO and WMO have one of the oldest memoranda of understanding in the UN system. So 1952, just a couple of years after the two organizations were established, we already established an MOU because it was clear that climate and weather have a massive effect on health. So we know we have to do this. We perhaps haven't done as much of it as we should up until this point, but now it is absolutely clear that we have to work together. And the final thing I would say about this, the reason that we have to work together on those interventions is that it is pretty pointless to get health people to try and do meteorological and climatological analyses. It's as pointless as asking a meteorologist or a climatologist to run a health intervention or to be a medical doctor. That expertise for us lies down the road at WMO, and at the national level, that lies in the next building along or further along in the government complex. That the Ministry of Health, there is a national meteorological agency, and part of the business that we're trying to do, and also setting an example from the international level, is to work closely together, because it's the only way to do it, is to tap on that expertise on either side.
I also have to just say here, I mean, this is the first time that WHO has had a health pavilion in COP. So the moment saying it is now, it really is now that we've had that opportunity. I'd like just to pass to Judy Amumbo for the Science for Africa Foundation. Judy, could you just elaborate a little bit of your experience in this area and the work that you've been doing? And then why do you see that the opportunity is now?
So thank you very much, Madeleine and colleagues. So it's now from policy to research. And I'm saying it in that direction because we often say from research to policy, and that's a very flawed way of thinking of things. I represent, researchers from low and middle income countries. We have the organizations based in Nairobi, Kenya. It's a Pan-African organization that looks at the research environment and is recognizing that research comes out of an environment. It's not just about building African scientists to become senior leaders in their own field, but to really be involved in an environment, an ecosystem that where research addresses needs of people. So what we really would like to do is develop scientists who first look at what is available at policy levels. And in the health sector, we would be looking up to bodies, WHO, national health services, and address priorities for research. I don't think Africa is really in a position at the moment to just be doing research for the sake of research. Funding must go to do research that is changing people's lives, and that's a really important thing for us. For now and for today, it's really just wonderful to finally see that there's a recognition that health comes within an environment, and it's not just an environment; it's the environment. So if we do not look at the interventions for health in terms of the environment, you lose that opportunity where people take the opportunity to, they take the responsibility for their own health. And I think this is really what we're talking about when we talk about concepts of One Health and environmental involvement in health. It's about the people and the people's intervention in their own interventions as well. So for me, this is a very exciting opportunity at the moment. We've been working in capacity building for a very, very long time. And I think it's finally time when we can start beginning to think, what will it take to address what Diamid has raised? The fact that in the past, we've always seen, health people need to know how to analyze meteorological data. That's the wrong approach. Or meteorological people need to understand what the health people are. And then we just put these two communities in rooms together and expect some magic to happen. I think there's a need to begin thinking about how we can make that environment of research healthy enough to address challenges that or priorities that governments have put as issues for their country. So we're building all-round scientists who understand that health is about the environment. They need to understand that environment. They need to understand about the food systems. They need to understand about policy. And this needs to be we need to think about ways of putting this into the training of professionals who are in climate sensitive sectors across looking at curricula right from the start in the pipeline, because it's really broken. The pipeline for professionals is really broken in the sense that you have your training perhaps at a lower level, then as you go further up, there's no indication where you are going to be in the future. But I think if we do take advantage of this kind of environment thinking, then everybody will know where their training is taking them, rather than waiting until you're a senior level DMIT, going for a 2-week course to understand how to do health work. Also, we just need to rethink how we do research and how we prioritize it.
I think that's a really important segue. Is like the choice about priorities. So obviously representing the Wellcome Trust, a charitable foundation, we think about where should we invest, what are the opportunities, what will actually make a difference. And that's a really difficult question from the perspective of a foundation. But let me just start with you, Ian. Like, where do you think the investment should be? What do you think should be the big priorities going forward?
Yeah, I mean, from the hazards and the modelling sort of side of things on the weather, we're always going to be after more investment in our monitoring infrastructure. I think in developing world that's where the identified gap is at the moment. Believe it or not, the amazing science will continue to improve. In terms of the specifics of the health side, well, again, it wouldn't be for me to say what are the health priorities moving forward. We're here to enable whatever those priorities are by listening to our colleagues in WHO at the local level, and then to find the best ways to provide that weather and climate data and information and advisory services to actually match up with those needs. So for me, if I was to sit here and say what I think the health priority is, that would be a very bad boy Ian moment.
Thank you. Okay, then I'll frame this maybe slightly differently for Dermot, because obviously we have a representation from WMO, a representation from the health sector and from the research community. But there are maybe plenty of other communities that we also need to engage in this space. I went to one very interesting session this morning on BBC Media Action about using the media to translate information. So if we're going to ensure that the work that is being done through WHO, WMO partnership, and that the researchers are able to actually do research in the right area, how is that going to be translated to the communities? Who else do we need to have on board to be able to do that?
I think the easy question to that is just to say, well, you need to get the communities involved. And it's a very easy thing to say, but it is the right thing to say. One way or another, if we're sincere about improving people's lives, then there has to be some kind of direct consultation with the communities whose lives we're trying to improve. So, just as I think we've heard, we don't want to all pass the buck here. WMO will say, well, it's not for me to say what's important, and I can say, well, it's not for me to say. And researchers will say, well, it's not for us as researchers to say what's important. But I think that, and we could all pass the buck down to somebody, a woman in a village in a vulnerable community. But to be honest, she's got more than enough on her hands, already to say what the problem is. But there has to be that join, and I think we all have to play our parts in this. So I'll just take the easiest example, the simplest example in terms of mechanisms I would say is heat waves, because we know they kill people, we know what the biological mechanism is, and we know they're going to get worse because of climate change, and we know that there are some compounding factors. And yet still, in order to protect people's health from heat waves, we could just see that as a research and technical issue. WMO and colleagues could give us projections. We could say what the evidence is of the causal relationship. But in order to have an intervention that actually protects people's health, you still need to talk to the community. You still need to consult them about, for example, if you were to put in place a heat health early warning system, how would you hear about it? How would you respond to that? And to come back to your example about the media, how would you, would it be the media that broadcasts this? And what are the roles of each of these stakeholders? And so I think it does have to start with a clearly identified need, which has a real demand from the community. It has to be evidence-based, and it has to make use of the best capacity from the different communities. And as soon as you've said that, you realize that there need to be at least sort of 4 or 5 different parts of the chain in order to really make this work. And I would say that in the past, sometimes we've got 2 of those. Sometimes we've had, the Met Service and the Health Service talk to each other, or WHO, WMO talk to each other. But at some point, really, it has to join up. And I think the more efficiently and seamlessly we can join those up, the better. But it isn't easy. It's an easy thing to say, but it takes investment, it takes sustained investment to actually make it happen.
So I'd just like to bring Judy back in this for 1 minute, because then we're moving on to our next session, and that is the role of transdisciplinary research in developing the research agenda, where you bring in stakeholders and policymakers from the get-go.
So a question that you addressed to Diarmaid earlier, what else we need to add. I think as researchers, we've left out the social sciences and humanities a lot. We're working with human beings. So it seems obvious, but it doesn't. It never happens that way. There are issues that we need to allow experts to address. Equity, for example, what it is that researchers must be considering that all the time. And there are many things about all the things about behavior, and even how to address decisions that are made at policy level. So there are ways that we must revolutionize the way we do our research and make it truly transdisciplinary.
Thank you so much, and thank you for all of our panelists. Very happy to keep you here, if you don't mind, till the end, so that maybe we'll get a chance for some questions. But I'm going to turn over now to our online contributors. Are they available to us? Okay, excellent. And we have, like I said, 3 case studies that are going to be presented. The first is going to be presented by Giovanni Leonardi from the UK's Health Security Agency in partnership with the UK Met. So over to you, Leonardi.
Thank you very much, Madeleine. Thank you to the organizers for inviting me. Can you hear me?
Yes, very well, thank you.
Fine, thank you. And thank you also to the Met Office for developing the space for this to happen in partnership, and also today allowing me to present on behalf of both our organizations. This is a snapshot from the UK about a data platform, but really about the context that allowed it to be developed as a partnership project. So this is, you see several people named there, as well as Rosa Barciela, principal consultant with the Met Office, Yolanda Clelo, and many others. Christoph Saran helped from the Met Office, but also Bernd Eggen from the health side and others also. And I return to that when we talk about the partnership needed for this. But this is a product called Environmental Public Health Surveillance System, which is it's a tool for surveillance. So if you go to the next one, you can see that there are some usual tools such as maps and tables. How did this come about? It was a capital funded project from the health budget. But in fact, most of the budget, you could say, is been developed over the years with in-kind contributions by the 2 agencies. And this is now completed, and it's got a user-friendly graphical interface to allow non-computer developers type scientists to access data, analyze. And so it allows for longitudinal and cross-sectional studies of health effects, weather and climate. It basically brings to the user observational weather and atmospheric data from MIDAS, the Met Office Integrated Data Archive System, and makes them available to authorized users, and is also designed to be able to bring in health data such as on infectious disease according to what the users require and the governance that approves that. You can also see the output is in the form of simple Excel spreadsheets that are easy for public health analysts to access and use. And there's more ongoing work on making this accessible, not just to internal users to the agencies, but also many external users, such as health service users, government departments, and academic partners, such as are already funded to work on these topics. And it's been presented at several conferences already, including ECMWF and PHE, Public Health Science Conference. And next slide, please. So the users of this have been instrumental in designing the system. So this has been based on the experience of several types of use, such as real-time syndromic surveillance, long-term epidemiology, infectious disease epidemiology, event modelers on chemical, environmental, radiation hazards. They all have overlapping requirements. So it's been possible to come up with a set of requirements by the users that really has been possible to implement. And so some examples here on the right, you see just a map of various meteorological parameters used by emergency planning, surveillance, and research users. You see on the left in that busy slide is just a summary of many seasonality analysis of different infectious diseases, which is been led by Gordon Nichols with colleagues in the health agency as a starting point for then teasing out the different factors affecting the pattern of infectious disease in relation to climate. And in the middle, you see an example of a response relevant analysis, which is the temperature relationship with ambulance service use, which is call-out rates in relation to weather pattern. So it just illustrates a range of users that have helped to design this, and therefore we expect that they will continue to use the system and want to have it available in the future. Next and final slide. If you're interested, please, you're welcome to contact that email there. And also, you may find of interest a video which we developed, where really the background that I couldn't have the time here to share, but it's really pointed to the fact that none of this could have happened without an existing infrastructure for governance of justifying why such data linkage is needed for different users, and what is the research community funding that has been at the basis of developing the infrastructure concept, and then the network of climate scientists, epidemiologists, public health analysts that has had to work together for years. So really a history in that video is a very short video, a history of the institutional support for this infrastructure for research and public health analysis that is really of potential value to others, and we intend to make it available to as many people as wish to see the experience here. Thank you very much.
Thank you so much, Giovanni. And really, you could see that the dramatic shift and change that's happened in recent years, bringing these different data sets together, which has been such a struggle. I'd like now to turn to Andreas Matsarakis from the German Meteorological Services, who's going to present on heatwave early warning in Germany. Hello, Andreas.
Thank you very much. Good evening from the Black Forest. Ladies and gentlemen, the heat health warning system in Germany is running since 2005. We use the daily weather forecast information, and we use specifically air temperature, humidity, wind speed, and radiation, and we use them in order to estimate the perceived temperature. The perceived temperature is an equivalent temperature, something like a real field temperature, which describes the overall effect of heat on the human body. And the perceived temperature is one of the recommended thermal indices for human biometeorological studies. And we have combined the perceived temperature with retrospective daily epidemiological data for more than 40 years in order to set up the thresholds for strong and extreme heat stress. We include also an adaptation procedure of the previous time, that means about 30 days. And we consider this also for the lower thresholds for early heats in the year, mostly for May and June, where the differences are much higher than the reality. We consider and quantify also the nocturnal situation by an intermodel for temperature, and the combination of daily and nocturnal situation with the urban heat island, because cities are mostly in the night much warmer than their surrounding, and also focus on elderly people exposition, then we get automatically from the weather forecast a proposal, a warning proposal, and this warning proposal is checked and approved by a biometeorologist in the lab in Freiburg. And the final warnings are released on county level and is distributed. And this distribution and the release of the warnings is based on existing administration agreements of the 16 federal states in Germany, specifically the health ministries. And the way of communication is done by email, newsletter, but also by internet and specific applications. Next slide, please. In the warnings, we include the duration of the heat wave and the elevation in the specific county. It's about 350 counties in Germany. And we have two levels of warnings. The first is a combination of outdoor, indoor, elderly, and UHI. It's also elevation in the county and the duration. And level 2 is only for the extreme situation where minimum requirement is that the perceived temperature is higher than 38. Next slide, please. Some information about the communication. The target for us and for the warnings are not only the health authorities, but also the elderly people, but also everyone. And for the level 2 warnings, this is the extreme level, we focus and we recommend in the warnings the neighborly help. These warnings are the official warnings in Germany. And there are specific smartphone applications. One of them is an application called Gesundheitswetter, healthy weather, which includes not only the heat health warnings, but also the UV warnings and specific information about pollen and also about diseases. And this information, especially for the heat, is also included in several other applications from the government. That's all. Thank you very much.
Andreas, thank you so much. And I'd now like to pass to Roque Mahon from the Caribbean Institute for Meteorology and Hydrology. You have the floor, or the screen rather.
Perfect. Thank you, Madeleine, and good evening, everyone. We at CIMH thank the WHO and its partner, the WMO, for this important opportunity to share the Caribbean experience with you today. As we all know, small island developing states are at the front line in terms of climate impacts, which puts the health and well-being of our populations at risk. And it is no different here in the Caribbean, which is one of the most climate sensitive and disaster-prone regions in the world. So in this brief presentation, I will focus on CIMH's role as a Regional Climate Center, or RCC, for the Caribbean, and the strides that we have made in building partnership-driven climate services for health. A great example of this is the Caribbean Health Climatic Bulletin, which has become a key tool for climate-smart health decision-making. So I want to begin by saying that as the Caribbean RCC, the CIMH produces a range of climate products, and these are both climate monitoring and climate forecast products. And you see some examples here. These climate early warning products are routinely and freely made available to the region every month and are potentially useful to the health sector as it responds to climate extremes like drought, extreme rainfall, and heat waves that are, of course, expected to become increasingly more intense and frequent in a changing climate. Next slide, please. So when it comes to the health sector, I think what's interesting for us is the results of a 2017 Paho country survey on health and climate change. As you can see, these results make clear that Caribbean health professionals rated many topics where CIMH is actively doing atmospheric monitoring and forecasting, and increasingly interdisciplinary work as extremely important or important. And you see these here, themes such as vector-borne diseases, weather and emergencies, food security and safety, waterborne diseases, among others. Now, what we know is that the most useful type of climate information is tailored to user needs. And what I'm talking about here is sector-specific information, information that doesn't leave the sector stakeholder wondering how they can apply this generic climate information when they get it, because actually those applications are already messaged out for them. Next slide, please. So this is why investment in partnerships for the development of health-specific climate information was critical. Importantly, the lead organizations on climate and health in the Caribbean, the CIMH, the Caribbean Public Health Agency, also known as CARFA, and the Pan American Health Organization, Paho, are all very serious about working together on climate-sensitive health issues. And so you see here in the bottom right picture, Dr. Joy St. John, head of CARFA, signing a collaborative letter of agreement with CIMH principal, Dr. David Farrell. This was signed for the express purpose of co-designing, co-developing, and co-delivering climate information products for the Caribbean health sector. And of course, this is all a part of a larger regional cross-sectoral alliance for climate services called the Consortium of Sectoral Early Warning Information Systems across Climate Timescales Coordination Partners that was established in 2015. Next slide, please. So we've had a lot of success so far with this partnership model. One of our earliest successes is the quarterly Caribbean Health Climatic Bulletin that has been jointly co-authored and co-delivered by the CIMH, CARFA, and Paho since May 2017. We're now 18 issues in, and I think we can say that the Caribbean HCB is our premier integrated health climate early warning product. Essentially, it is a climate smart tool that helps the health sector in Caribbean SIDS to better manage climate risk. Now, how does it do that? Well, it provides health administrators and doctors with the seasonal climate early warning information that they need to identify and prepare for upcoming favorable or unfavorable climate conditions in the next 3-month period. Perhaps the most useful information provided in the Caribbean HCB are the implications of forecasted seasonal climate in a number of key areas that very much align with the themes that we saw prioritized by countries in the 2017 Paho country survey, themes like respiratory illness, gastrointestinal illness, vector-borne illness, non-communicable diseases, well-being and mental health. These are all themes that are given a space in the bulletin. Of course, use of this information can help to inform strategic and operational decisions related to the management of diseases like dengue, which is estimated to cost the Caribbean over $300 million annually. Now, in terms of what's next for the Caribbean HCB, well, we continue to work with our partners at CARFA and Paho, as well as international research partners, on joint modeling research that is paving the way to providing fully quantitative and integrated health climate advisories in the HCB in the future. And of course, our hope is that this will lead to even better climate smart health decision making. Thank you very much.
And thank you, Rohit. That's really great. That's the close of our country case studies. And now we're going to move on to the final session, where we have, first of all, Julie Turchan, who is responsible for developing and implementing NOAA's health strategy, NOAA, part of the federal government in the US. And Julie also serves as the other co-chair of the WMO, WHO Health Study Group.
Study group.
Yeah, sorry. Julie, over to you.
Thank you so much, Madeleine, and thanks to all of you for being there present and for allowing us to join you remotely. I am thrilled to be here speaking on behalf of, in general, the Met community and the climate and weather community. So if you could go to the next slide, please. we probably don't need a ton of time explaining why we're here, but I do feel like it's important to kind of restate the obvious. We know the world is warming, and we are seeing increasing impacts of this on a daily basis, a yearly basis, whether it's increased wildfires or increased heat waves, longer heat waves are starting earlier, drought and all of its impact, water scarcity, or even flooding and hurricanes. The impact of climate on our health is ever present. It's not something that's happening in the future only. It is here, now, in the present. Next slide, please. So in that regard, we heard from the panel this morning from Ian in particular on the development of the new climate services sector, and the whole focus on service delivery within the WMO. And this slide here really says, all right, we are seeing increased service delivery. This is a study done by WHO, actually, that is talking about how much of the climate information is actually being produced for the health sector. And that's great. You can see the trend going up. But if you actually look closely, whether the information is being used, the number is far, far smaller. And so what this says is, as Madeleine introduced, why now? Why is this important? Because we see the impacts, because our society needs this kind of information, because we are able to do this now in a way to use forecast information that we didn't have before. But the reality is we still aren't there yet in terms of really institutionalizing how we integrate climate and weather information into day-to-day operations of health professionals, health practitioners, and people around the world who want to do a better job of protecting their own health. So we have progress, but we have a lot of work to do. Okay, so next slide, please. And WMO, you've already heard a couple of the panelists earlier speak about the connection between the World Meteorological Organization and the World Health Organization. But in 2018, the leaders of those two organizations realized they really needed to do something differently and begin to institutionalize some of these changes. And there is a collaboration framework on health, environment, and climate. And it's really designed to provide alignment of the relevant policies, increase awareness and promote the generation of scientific evidence, research, and actionable information, develop appropriate tools and mechanisms and partnerships to actually deliver services. So to the point raised earlier, having somebody from WMO say, here's what we think you need, or WHO saying, here's what we want. It really has to be a collaborative enterprise. And this is from the highest level here saying, yes, this has to be a collaborative enterprise, not just at the UN organizations, but facilitating that to states and national level as well. And then there's a piece that Dr. Mumbo talked about with building capacity, not just among climate and health professionals, but the workforce and general public as well. But really, how do we actually disseminate this information, establish the right kind of guidelines, and get some kind of normative standards so we can begin to function in a different level to address these climate-related health risks in the future. And then the last piece there is monitoring progress of all of these tools and products that we actually implement. Next slide, please. Okay, this is a little bit of a scary slide, but it's designed to show you that we fully aware that we're not starting from scratch, and there are lots of really good organizations within WMO and within WHO that are working on pieces of climate and health issues already. And part of the job of the Joint Office for Climate and Health, the new study group, which I'll talk about a little bit more in a minute, is to really weave these pieces together and to build on this capacity. These are all parts of WMO and WHO that have climate health connections, and they're all great standalone. So we're trying to learn from all of these efforts and really weave them together into a lessons learned and a cohesive whole about how we actually change and codify some of the best practices among these groups and support them so that they can continue to tackle the problems that they're tackling here. You'll see one in particular on the infectious disease and modeling climate work. I think that's UK. Matt has been heavily involved in that. And the message we heard earlier about that collaboration being really important is true in every single one of these. So I won't go through all of them, but we heard reference already to the infectious disease one, and some on water and sanitation. And certainly urban services is a huge effort and a huge priority for the world as the cities become larger and larger. All right, next slide, please. Thank you. So because we have this framework, and because we have this new service commission, and because we have the ability to work together more seamlessly between the World Health Organization and WMO, it allows things like this COVID task team to be stood up relatively quickly. We had some serious questions early on in COVID about what were the environmental drivers and what could be predicted and how do we use this information? Is there seasonality to it? All kinds of questions that we now know a little bit more about, but we know more about them because we were able to stand up this kind of a group. WMO says, yeah, we need to understand this. We have partners in the health community. We can ask the right questions. We can get the right people to the table and have that conversation and produce some information that not only Met services, but hopefully health institutions and the general public actually need to know about the environmental drivers for COVID. So this is one example. A few of the things that happened was, a big workshop on this to kind of figure out the state of play, but also like a framework paper. What do we actually need to do, and what are the big high-level pieces, and all the way to some roundtables and things that really tackled some specific topics. And this is a task force that will have, a life expectancy of a few more months before we can, sunset ourselves. But we were able to respond quickly because we are beginning to really understand and implement what it means to be institutionally connected. Next slide, please. So on that point, I have the honor with Dermot, who's in the room with you, of leading this new joint study group on integrated health services, which Ian mentioned earlier as well. And the point of this group is to really take a lot of these lessons learned and figure out how to, what does it really look like if we have integrated climate services for health across the board? What would the role of WMO and WHO be? What would the ministries of health be doing? What would Hydro Met services actually be doing? We heard some great examples of that before. Strategically, what would we invest in, and what kind of institutional collaborations would we be fostering? And then, obviously there's some technical components about what should be provided and some standards there too. But I am particularly excited about something that sounds very bureaucratic, but these are the places and these are the people, and learning from the folks on this panel and many of you in the room, what is it that you are doing right now? What's working and what's not, and how can we actually facilitate and integrate this into a more systematic way of approaching these problems in the future? So you'll see that we've got members across the board from different parts of the world, different expertise, and one of the things that we're planning on doing, next slide please, is tapping into the health focal points that were officially nominated by WMO. So there are 56 countries and 83 health focal points already nominated from their Met services. And the World Health Organization has similar kind of structure. So what we're doing is as a health study group is a series of consultations with the health focal points. We'll be working with them as they develop this capacity in their region. But the health focal points and Met services and Met focal points and health services are really kind of where we're looking to help get a feel for what's happening on the ground and make sure that we are actually addressing the needs from people on the ground, from decision makers who are tackling real problems, as we heard earlier. Dermot, your point about the woman on the ground who's trying to find clean water is probably not the right one to actually do this, but we do need to be serving her. And so we're working through a distributed way to try and make sure that happens. And last slide, please. So these are just a few examples of some of the collaborations that show the integration that we're talking about. I mentioned earlier the COVID task team. There's the Global Heat Health Information Network, which is, again, a partnership on public health, climate, but also a lot of other sectors, urban design and planners and emergency managers, and a whole gamut of folks involved in managing heat risk. We also have the one on the right, which is really trying to understand practices on infectious disease modeling. They've done a lot of work on cholera and other things, so we're trying to distill up that information. And I will just leave and turn it over to Joy with Madeleine's permission. The last piece I'll focus on is the Climate Health Portal, and that is really a way for us to reach out, gather information, and communicate more effectively. So that's it from my side. Madeleine, thank you. And the next one is up on Joy.
Thank you so much, Julie. And Joy, delighted to have you with us. Take it away.
Excellent. Thank you, Madeleine. So I am really excited to be presenting a sneak peek of the soon-to-be live Clima Health Portal. This is a project that has been years in the making. It has literally involved probably hundreds of people in shaping its design to be able to respond to the real-time needs for information and guidance across the growing community, both in research and in practice, that are now taking action to address climate change and health risks around the world. So this online platform of integrated health and climate knowledge is bringing to life a curated collection of resources, of data, applied decision and learning tools, and it's really going to be a critical instrument for helping us see this scale up of climate services for health and health adaptation. And there's been a real gap and need for this kind of tool because for years, many of us have been hearing things like, oh, I just didn't know that this tool set existed or this data existed. Can you send it to me? Or getting requests, the Met Service has been asked to develop a heat warning system. Well, how do we do that? Are there norms and standards? Or how do I find out what's happening on climate health in Zimbabwe or Indonesia? Well, now this is all online. So let's have a look. If you can go to the next slide, we'll dive into what you can expect and see in this new resource. So this is the homepage, and you can see from the top, it's organized around what you hope to achieve on the site. So is it to understand climate and health, to take specific actions like conduct an assessment or build an action plan? Do you just want to learn more about available resources, or is it to connect with others? So you can also explore the site by country, by hazard, by theme, use the map function, or consult a data dashboard. But Clima Health fundamentally is about helping people navigate and find the best available knowledge to better anticipate risks and better inform the decision-making, whatever that may be, from health service delivery to policymaking in the context of climate and health. Next slide. So Clima Health has been designed to meet the needs of a wide variety of different users. And during the design phase, we collected almost 3,000 separate questions that possible users were asking. And then we have tried to design a site that's going to respond to the majority of those needs in a sustainable way. But Clima Health is going to be a living resource. It will evolve and grow over time, and it's going to be continually adapted and updated as a resource site. Some areas may be updated annually, others may be updated on a weekly basis. But we are really anxious to launch because it is going to be a big step to increase the visibility of what is the relevant science that is out there and available to be used by health partners, what is good practice that can be shared across partners and key actors. And it's going to help improve the connectivity between people at the national level, the global, the regional level, who are working in climate and health research and practice. So next slide. So what's in the site? First and foremost, users really asked for help in finding trustworthy and legitimate sources of information. So in collaboration with a team of experts, and also with the WHO Collaborating Center at the US National Institutes of Health, we have now a resource library featuring over 10,000 curated resources as our starting point. And it brings together not only the peer-reviewed literature, but often the hard-to-find gray literature and guidance of WHO and WMO and other UN agencies. We have a very clear editorial process and guidelines and an expert review process of all the content that's included on the site. But ClimaHealth really aims to be a first stop resource for professionals, academics, the media, and students alike to help them navigate to the most useful, trusted, and relevant sources on the topic. Next slide. So secondly, the platform is designed to meet the needs of both entry-level users who may be students, the media new to the topic, as well as expert professionals who are looking to find the most up-to-date reports or when an expert meeting may be happening or find notifications about funding opportunities. So we're really trying to meet a range of needs. And here we're looking at the entry-level section called Understand, that introduces the key concepts related to climate and health and helps a user navigate to the relevant resources throughout the site. Right now, the platform is predominantly in English, but over time, it's going to become increasingly multilingual in the 6 UN languages. And already the library features many resources in their original languages, which will be searchable with English translation titles. So if a report has been produced in Spanish or in French, the original language will be available for download in the library, but you'll be able to see an English translation of that title to simply know that tool, that resource exists. So we're really going to be working on the language accessibility of the site in the years to come. So next slide. For advanced users, another major need is really around how to develop climate services and how do we apply climate science in health research or in other decision tools, like a climate-informed early warning system for a disease like dengue. So next. So to help develop climate services, we have brought some of our existing guidance online and created and tested a new climate service readiness tool that can help you design better projects. And so by downloading the planning tools, you'll see in the green boxes there, and using the wizard to walk through a series of steps and questions, it will help you better assess the feasibility of your project. Is it really going to be possible? Do you have the right data? Do you have the right partners? What steps do you need to take in designing a more effective and more successful project? And this has been built on the best practices, good practices, and learning over the years throughout the community. So this area of the site is really about capacity building, and it will also direct you to case studies of how others have accomplished similar projects, and then it will lead you through a searchable library of specific tools, information, products that could help develop your product, whatever it may be. Next. And sometimes you may just want to know more about a specific climate-related health hazard, like drought and health in this case, or heat waves and health, or also a thematic area like risk communication or One Health. So here you navigate the site through the hazards and theme pages that present topic-specific overviews, and then they're accompanied by sections that point you to relevant guidance, both produced by the WMO community, but also the WHO and health community on how to address health risks in the context of drought. Taking the example of this page. So really in-depth resources specific to the hazards and risk being managed. So next slide. We have 13 climate-related health hazards and 9 thematic pages. And all of the content in the library is filterable by these hazards to allow you to again, navigate in different ways to this thematic content. Next slide. But we also know that many users want to dive right in and find out what's happening in a specific location. And here you'd want to navigate the site by country or use the map function that will be on the homepage. Because all UN member states will have a country page that displays content that's tagged to that country, such as publications or tools or expert groups specific to that country. Additionally, the site features 2 data sets from WHO that are unique to the site. So many of you may be familiar with the climate and health country profiles down in the left corner, produced by WHO and UNFCCC. These are available for about 60 countries, and they highlight the major current and future climate risks in a country and what's being done by the health sector. There is also the WHO country survey of progress that is being made at the country level on climate and health. And both of these data sets have been integrated in the portal, and where they are available for the countries, that information will display on those country pages. There will also be a progress dashboard where you can compare different country data from the WHO survey. So we're really excited about this feature of the site. It's unique to the site, and we think it will be very helpful to a lot of people. So next, another unique asset to the site is coming from the WMO community, which are called the service provider profiles. And right now, it is quite difficult for health users to be able to identify the relative climate products and services that might be helpful at the national level. So we've been working with Met Services for the last 2 years to identify and collect the relevant publications, tools, and activities produced at the national level that may not otherwise be known about. And so here you see an example of Argentina, but these pages almost serve as mini climate service for health web pages for the participating Met Services. And they're going to be really helpful to showcase the national products that have clear and direct public health value. And so you may see things like the tailored bulletins or early warning systems or the integrated surveillance that we heard about in the case study presentations. All of these contents have also been included in the library. So they're cross-pollinated throughout the website, and by doing this activity in preparing for this functionality, we've been able to surface a huge array of new and available science and applied products that can be available. So next slide. And finally, this platform is also really about connecting people to learn from each other. And so here in the Connect section, we'll be featuring events, links to expert groups, things that are going on, and other ways to get involved in climate and health science and practice. So next slide. I know you want to know, when can you start to look through this? We are currently going through the final technical review, but we'll be launching a beta test by the end of this year and seeking your feedback and thoughts on how it can be improved. We'll be doing that for a few months before a formal launch planned in the spring of 22. Next slide. So again, please stay tuned. If you'd like a notification, please send us an email at the Climate Health Office at wmo.int, and we'll add you to a mailing list for a notification. And once we're live, again, we invite you to provide feedback, help us identify the missing resources, and promote and use the site to build capacity so we can all help scale up adaptation in the health sector. Thank you very much. Madeleine, back over to you.
Just lost you. Oh, okay. So, well, first of all, I was remiss in not actually introducing Joy properly. It's Joy Guillemot Schumacher, who is actually leads the WHO WMO office based in Geneva. So thank you very much, Joy. I know that it's late for everybody and that people have dinners and other activities to move on for, but if there's just a couple of quick questions, we have our folks are still here. So do we have any questions from the audience?
So in the United States, I've worked with promotoras de la salud over the years, just basically community workers who go out and try to communicate and educate community, right? That access that you were talking about. Unlike other diseases, actually we can always focus on prevention of diseases, but when it comes to climate, these are things that are, the impacts are all human induced, right? They're created by what we're trying to avert through this conference. How can you marry what you're doing, which is clearly addressing the issue once it hits, and also engage the community in preventative efforts? How can you help them visualize the climate science by making it personal and real as something that impacts them, so that not only do they prevent themselves of getting heat stroke at 3 p.m., but also prevent the continuation of pumping carbon in the atmosphere through contingency?
I'll have a first crack at it. I think this is one of the opportunities that's comes out the last 20 months of COVID, to be honest. Who would have believed the certain degree of social science experiment that we've had over the last 20 months, never mind what's happened with COVID, and the importance of actually affecting behavioural change on vast numbers of the public. I think if we don't use the lessons that we've learned over the last 20 months and what's worked and what hasn't, then all of the great stuff that we're doing and all the things you're talking about right now, again, we do run the risk of all these fantastic facilities that we're standing up actually not having the impact that we wish them to have. And again, just remind ourselves the importance of social science. I think this is the thing with governments. At the beginning of all this, governments were doing what they thought was the right thing. We're being led by the science. When the social scientists came in, that's when the impacts really started to have an effect, in actually communicating in a way that people could understand, appreciate, and, could see the benefit of what they were doing. So, for me, let's learn from what's just happened. Thank you.
Any other questions?
Hi, thank you so much. My name is Julius Alejandra. I'm from the Philippines. My question is for Diamond and Judy. In developing countries where universal health coverage is a problem, how would you marry environmental sustainability with universal health care? Obviously, they need to build healthcare centers, transport these resources to this rural community. So how would you marry two governments and advocate for universal healthcare coverage as well as sustainability?
Thanks. Of course, that's a fantastic question. And I think we have to be clear that in looking for environmental sustainability, that can't be at the expense of other priorities that we have. We're, as WHO, as the health community, we're never going to compromise on saying there should be universal health coverage. We have to get to universal health coverage. And we should also we should avoid the trap of having a trade-off, a zero-sum game of saying, well, we would like to pay you for and support your universal health coverage, but in fact we're having to spend the money on climate change mitigation, for example. There is enough money in the world in order to do both. And the other thing is that many of the things that we would like to do, need to do to provide universal health coverage, if we do them right, can also support environmental sustainability. We can sometimes be a bit naive about saying there are win-wins and everything's a win-win, but there are some win-wins. There are investments that can be made in more sustainable healthcare facilities, in access to renewable energy for healthcare facilities. And many of these will save money now, and they will also improve the services in the future. And if they don't save money now, often the return period the payback period is relatively short if you can get the finance up front. So I think that we have to be clear that we do have to integrate these things. And the way that I think we do this is just by painting a positive vision of what that universal health coverage now needs to look like. And rather than having this competition between the two. And I think most people will buy into a vision of universal health coverage with healthcare facilities that are also, more environmentally sustainable, transport systems which are also better for health as well as the environment. Because the evidence shows that overall for society, the payback is bigger. That if we were to meet the Paris climate goals, for example, the health gains alone, just from improved air quality, would be twice the cost of mitigation. So it may not be the right money in the right place at the right time, but it is very clear that these things can coexist, and in fact they need to coexist.
To add to that?
Yes, just a little bit, because I agree with Dermot, of course, with all of that, and then we need to recognize that there's a huge part that the community can play as well. Around education, particularly on the environment side. We're still very, very far away from the behavior change that needs to be effected in terms of protecting environment, pollution. All of these things are man-made and involves, again, social science to just effect that behavior change.
Thank you. So do we have one more question? If not, I'm going to add another piece to that. You are talking about how do you get the community engaged. My big struggle over a long period of time was how to get decision makers who have focused on climate sensitive health outcomes but don't really get the climate piece. And for a long time working on early warning systems and then being told, there's one person in this whole organization that works on early warning systems. The idea then changed to, let's see how climate actually affects the bottom line. And for an organization like the President's Malaria Initiative, it's reporting back to Congress on what they've done with the resources that they've had in terms of reducing child mortality, etc. And when we could show decision makers that actually that impact assessment was incredibly climate sensitive. If you have a major drought across the region, malaria is going to go down, irrespective. The vectors are going to change. So your accounting of the impact that you're having has to take into account climate. And once you start doing that, people start looking at the data. And once they start looking at the data, they realize how sensitive health outcomes are to climate, and they start seeing these long-term trends. So I think there's just a number of different ways you can engage decision makers higher up or lower down, but kind of thinking differently. So I'd really like to thank not only our panelists here, but all our online contributors as well, and you, the audience, that have stayed with us and asked really valuable and important questions. And particularly our tech support here, I'd like to give them an end-of-day round of applause because they've been absolutely fabulous and have kept the show on the road going through the whole day. So thank you and good evening.